Sue Klein. I am Sue Klein, the co-president of the Clearinghouse on Women's Issues, and I want to welcome you to our program today, which is on what are we losing in federal cuts and how can we get it back? And I also want to note that today is Earth Day, and I surely wish that we could celebrate Earth Day and much more today than this program will indicate. Instead, I will address one of our biggest, most destructive Trump 2.0 attacks is on the whole federal government. This includes the termination of agencies, cutting and firing of many government employees in the DC area, as well as the whole nation, and the cutting and weakening of whole programs and offices. Many of you have friends and relatives who are directly affected. I will outline the nature of this massive destruction of the federal government, and then the Social Security Works President Nancy Altman and Professor Leighton Ku will discuss the details of these attacks and specific programs and their impact. I think this massive, largely illegal Trump 2.2 attack on the total government probably was a big surprise to voters who elected Trump, and even to many Democrats who weren't aware of the plans for this massive attack. The attack on the whole of government was not emphasized in the Trump campaign, and many aspects were not even clear in the Heritage Foundation's Project 2025, which Trump had disavowed during the campaign, not saying that he would be supporting it or even that he read it. Although Project 2025 was criticized many government agencies and programs, it generally called for changes rather than their elimination, except for a few like the Department of Education and the Environmental Protection Agency. For example, in Project 2025, the U.S. Agency for Global Media, which houses the Voice of America and other media outlets, was criticized for its recent work, but generally Project 2025 asked for reforms instead of total defunding of the Agency for Global Media. Even I heard Senator Elizabeth Warren, who's very knowledgeable, she indicated that the scope and intensity of Trump 2.0 attacks on the whole federal government is much worse than she had envisioned. Although Project 2025 discussed government downsizing in general, it had some reasonable statements that they would be doing careful analyses of decreasing the size and scope of federal staff. And they would be even studying things like workplace flexibility and the use of technology. However, Project 2025 advocated more political favoritism for government workers and less protections for civil servants, like it did in Trump 1.0 when he had a whole executive order called Schedule F to reform how the government workforce was appointed. Also, there was no warning of the many illegal ways that Trump and Musk or Doge plan to cut staff and programs. Many assume that attacks on the government agencies and offices would be limited to those in the executive department and that cuts would be minimal, much like Trump 1.0. Many did not think that the popular, non-controversial government offices, including national parks and health research and many other programs, would be drastically cut by just decreasing the staff, which is what Trump 2.0 has been doing. The attacks on the whole of federal government were worse than we anticipated because we also assumed that many confirmed agency heads would want to maintain a good, vigorous, well-staffed agency under their influence that would do good work. We also assumed that there would be evidence and some justification for downsizing the federal government to save money. And we later have been learning that Musk and through Doge has not been saving as much money as he predicted. And many think that the use of money anyway was not needed to be saved to decrease the taxes of the already rich. And further, there were attacks on offices and staff that went beyond the executive department authority, and even the publicized Trump plans to terminate agencies. For example, it was not known so clearly that the Department of Education, like most agencies, was authorized and appropriated by Congress and could only be eliminated by Congress, not by an order of the president. And some, even like the U.S. Institute for Peace and the Smithsonian and the Kennedy Center, were not even under the authority of the executive department. And Trump's justifications for cuts in government offices and downsizing are rarely well justified. For example, the Consumer Financial Protection Bureau is saving money, not costing the government money. Often, Trump 2.0 does not use legal procedures to get resignations or firings, and it's been killing the independence of many independent agencies like the National Relations Board, the EEOC, and Federal Elections Commission, and many others. Trump even tries to control organizations or recipients of federal money, such as private universities and states. And he's also been overextending his authority by trying to influence his businesses and threatening law firms, making them many comply with his demands. And most importantly, we should remember that the cuts in these many federal offices have a disastrous impact on their contractors as well as their constituents and beneficiaries. Some of the most popular and well-known services are being cut these were things that no one anticipated, the government attacking. There are things like the Weather Bureau, PBS, food stamps, health research. There's even been talk in Trump 2.0 of cutting FEMA, which benefits. Often disasters happen in more of the red states. And and he, of course, plans to cut Medicare and things like that that he had said he promised to save. There's also surprising attacks on agencies like NASA, which were sort of favored types of agencies. But of course, even though some offices in NASA have been cut, Musk's Starlink program has not been cut. And sadly, there have been many cuts in foreign assistance programs, starting with this trying to eliminate USAID. Now, briefly go over what can we do to fight back about these attacks on all of government. And so many of these solutions are obvious. The elections are very important, and the influence on Congress. We have to pay attention to the budgets and the appropriations during Trump 2.0 and do what we can to stop the cutbacks. Another major way that we have been using that needs to be used continually and even more vigorously is litigation and lawsuits to continue the protections of civil service staff and programs. And it's also important if we could eliminate DOGE, the Department of Government Efficiency, which has been overstepping any kind of federal bounds of regular departments as it terminates staff, property, programs, and even sells government buildings. For example, Housing and Urban Development headquarters, which is just down the street from my house, is now up for sale. Then we need to do much more to convince some folks that the federal government, as it has existed, is of great value. And the government is built to serve and help states and others learn from each other and have many efficiencies that can't be done if each state tries to duplicate the services that the federal government has been offering in many, many ways. And conversely, we need to help people understand that the harms from downsizing the federal government are in general and also in specific offices, and our speakers will continue that. And of course, we need to stop the autocracy, make sure that we don't have a king, and maintain the balance of the judiciary and the legislature, and protect the judicial offices from major funding and other cuts and direction from Trump 2.0. Now I'd like to turn it over to Jan Erickson, my co-president of CWI, who will introduce Nancy Altman. Jan, take it away.
Thank you, Sue. Always a very depressing experience to listen to all these important programs that we fear we might not get back, but we're all going to work towards that goal, right?
Right.
I think we can return to a discussion perhaps at our next meeting as to whether any progress has been made on restoring some of these losses, these early losses. And of course, we can look forward to 2026 midterm elections to hopefully turn the situation around. So we've all got that in mind. I'm going to be introducing a person I've known for many years. She's an incredible source of information on a program that is most important to all of us, no matter what age we are. And I want to stress that for even our interns here at Now, someday you will be a beneficiary of Social Security. At any rate, we are extremely fortunate to have Nancy Altman. She is one of our most prominent Social Security historians and advocates. She's had the focus for 40 years on Social Security. Nancy's background is receiving a Bachelor of Arts degree from Harvard University and a Juris Doctor degree from University of Pennsylvania. She has handled private pensions as a tax lawyer and was also a legislative assistant and advisor to John C. Danforth of Missouri, Senator, on Social Security studies, and obviously there were some amendments were being offered to Social Security at that time. Altman was Alan Greenspan's assistant way back in 1983 while he was chair of the bipartisan commission, which adopted very important amendments to Social Security. Following that, Nancy Altman was a faculty member at Harvard's Kennedy School of Government, where she taught courses on Social Security and private pensions. Currently, she is president of Social Security Works and chair of the Strength and Social Security Commission. She's authored and co-authored many publications on Social Security, including The Battle for Social Security from FDR's Vision, when it was founded, to Bush's Gamble in 2005. More recently, she authored with Eric Kingson, another prominent expert on Social Security, Social Security Works, ! Why Social Security isn't going broke and how expanding will help us all. That came out in 1915, as I mentioned. It's a more recent book detailing what has gone on to that date. She's made many media appearances on major outlets. My own experience and Now's own experience with Nancy Altman came at a time when conservative national leadership, both in the White House and in Congress, were trying to convert Social Security to a system of private investment accounts, which would place Social Security beneficiaries, many millions of them, at the mercy of the stock market. The Strengthened Social Security Coalition, composed of hundreds of national organizations and unions, fought back successfully and defeated that effort, much to our relief at the time. Many advocates would like to see Social Security expanded and perhaps with more generous benefits, but certainly with secure long-term funding. And Nancy is going to provide more information about that. Nancy Altman, take it away.
Jan, thank you so much. Thank you for having me. And I really don't like to scare people about Social Security. And Sue, not to add to your depressing remarks that were really excellent, Social Security is in danger, thanks to Trump and Elon Musk. As Jan said, Social Security is really important to all of us. And to the interns, as Jen, you were talking about, it's not just that they may someday become beneficiaries. If they, in the tragic circumstance that they die leaving young children, Social Security is there. If they go out today and, God forbid, get hit by a bus and are so disabled they no longer can work, Social Security is there. So it's there right now for all of us. And in the past, this is its 90th year. It's been, it was enacted 90 years ago. It has never missed a payment. It's been there in times of war, in times of recession, during the pandemic. Unlike 401ks, which sometimes would feel like 201ks, the Social Security was always there, providing those benefits in full and on time and accurately, thanks to the civil servants who have always seen Social Security as a mission. In fact, it's the agency I'm most familiar with, and you can find people there whose parents and grandparents worked there. People who were there as I say, were not there simply for a job, but really saw it as their mission. There is a manageable shortfall, still more than a decade away, that should not concern anyone. There is no question that Congress will act before that. And what really they should act is to require the billionaires to pay their fair share, which they're not doing. And then the benefits Jan and I have said, we should be expanding the benefits, and they'll be there for our children and grandchildren. So that's all the good news. Unfortunately, the bad news started on January 20th. And as I said, the program's been around for 90 years, has never missed a payment. I've been working on it for actually 50 years, and I've never been as concerned as I am today about what is happening and on the reliability of those benefits. I was concerned in 2005 when President Bush tried to privatize the program, but to his credit, he put out his proposal out on the table. Everybody could debate it. They could, and the more people talked about it, the more the American people were united against it. And it didn't even get a vote in the Republican-controlled Congress. This is much more sinister what's going on now, and is much more in the dark. The good news, one more piece of good news about Social Security is that as polarized as we are over so many hot button issues, the nation is not polarized over Social Security. MAGA Republicans and progressive Democrats all say that they support Social Security. It should not be cut, that it's going to be more important than ever in the future, that indeed it should be expanded. The problem is that you have a radical group that are now in charge of the Republican Party who aren't honest with their own voters. You had President Trump go around the country saying, "Oh, I'm not going to touch Social Security, Medicare, or Medicaid." Well, he said that in 2016, and every one of his budgets included cuts to Social Security, Medicare, and Medicaid. Before he ran for president, he called it a Ponzi scheme and said he favored privatizing it. He also, though, understands the politics. He was on a Sean Hannity show, I think in 2011, where he said Republicans would never lose an election, would never win another election if they didn't get political cover in their desire to cut benefits. So he gets the politics, and unfortunately, I think he and the others have learned the wrong lesson from 2005, which is they want to get rid of Social Security, but they can't do it in the open. So let me give you some background about what's been happening since January 20th and where I think, where we stand, and I'm happy to answer questions if that would be helpful. So January 20th, as happens all through the government, we have an acting head of the agency. And the person who was named as acting was a woman named Michelle King, who had over 30 years of experience in Social Security, had been in charge of all of the field offices, 1,200 field offices, the regions, at another point in her career been in charge of the budget, had very wide-ranging knowledge and expertise, and is also nonpartisan. I've known her for many years. I have no idea what her politics are. She was a true career civil servant, had worked in Democratic and Republican administrations, and was the obvious person to become the acting commissioner. And she was in that role, working with the Trump administration very closely, doing what they wanted her to do until they asked her to do something which she found completely immoral, unethical, and perhaps even illegal. That was starting again in the beginning of the Trump administration. It's hard to believe it's only been whatever it is, not even 100 days, I think. Feels like it's been decades. But at the very beginning, there were Doge, Elon Musk's Doge minions were all over the agency nobody really knew what they were doing, but they were pushing for all kinds of things. And what they pushed Michelle King to do was give them complete access to all the data that the Social Security Administration has. Now, let me be clear. No one in the history of the program has had the kind of access they wanted. Not a commissioner, not the president, no one. Part of it is that this is data that we provide to the government under an understanding that it would be kept private. And in fact, the very first regulation back in the 1930s that was issued by the Social Security Administration was about keeping that data private. And in fact, every person who works for the Social Security Administration is required every year to go through a training about how important it is to keep that data private and to understand what that meant. So they wanted access to all of the data, including being able to the source codes where they could actually change the data. And so, again, knowing Michelle King, I'm sure she was very polite and explained to them that no one had that kind of access, that wasn't secure, that wasn't safe. What access did they want? Why did they want it? Maybe she could help them figure out a way to get the data she wanted and so forth. It's called sandboxing. Programs audited. Auditors only get certain select parts of the data that they need for the audit. Mission-driven people who work on it, that's what they get. Well, that was a Friday, and on Saturday, Michelle King was home. It was President's weekend, and she finds out that she is no longer the acting commissioner of Social Security. Who's the acting commissioner? A mid-level employee who they had to leapfrog over about 120 more senior career people to get to him. But he had one qualification. He actually was on administrative leave because he had been sneaking around his supervisors and giving stuff to Doge that they shouldn't have. So he was being investigated, but this changed that and he became the boss. So that's who the current acting commissioner is. And he's made it very clear in a couple different meetings that he's taking his orders from the White House. He's not making the decisions himself. And what are those decisions? They have completely hollowed out the agency. It is not an exaggeration to say it's probably close to 1,000 years of institutional knowledge and expertise that have either been pushed out the door or walked out the door in the last few weeks. People who had been at that agency for 30, 35, 40 years, all the top cybersecurity people, all the top people who maintain the website. And indeed, the website has been crashing regularly. It always needed maintenance. But now the people who maintain it are gone and it's been crashing and being out of commission longer. And that's just the tip of the iceberg. The people who are left, who are systems people, are kept in the dark. They don't know what the Doge people are doing. And the people that I've talked to who are are like me, more concerned than they've ever been before. What they've told me is that even in the most benign, even if they were just, there were no bad motives at all, that people who don't know the systems and don't know the program, because you have to know how the program works and where to, if you're making any changes and stuff, because they is likely to cause the whole system to crash, that it could have a cascading effect. And in fact, we know they're making changes because there's something called the death master file. Despite Elon Musk and Donald Trump lying and saying, oh, these dead people are getting Social Security, actually the opposite is the case. They are very diligent about determining when someone has died and terminating those benefits, that every year there are about 10,000 people who are erroneously listed as dead who aren't dead. And that is a nightmare. It's not that many people, but it's a nightmare for those people, because it means if they're older, they lose their health insurance. Can you imagine? Your Medicare's gone, your bank accounts are closed, your house is put up for sale. I mean, you're treated as if you died. And it can be, people can get in these endless loops. In fact, there's a class action going on now, led by the family of a woman who was inadvertently put on the death master file, struggled for months and months and months and months to get it corrected, finally got it corrected. But the stress of all that, according to her family, killed her, and she died shortly thereafter. So it's a very serious, but what are the Doge people doing? And I should say that the person at the White House in charge of Social Security is Stephen Miller. A lot of this is to get immigrants, because part of what's in those files are immigration status. Now, no undocumented workers have Social Security numbers and so forth, but there are plenty of green card holders. There are plenty of people who have student visas who get restricted Social Security cards. So they're all in the files. And what we now know is that they are listing a lot of people they claim are immigrants. Now, who, for all we know, they could have become naturalized citizens, but they're putting them on that death master file. The idea is so they can self-deport, although, my God, if you're considered dead, you can't get a visa. You can't get a plane ticket? I mean, the whole thing is just cruel and stupid, but that's what's going on. And fortunately, although I'm sometimes critical of the mainstream media, they've been really good on this issue. It has not been on the one side or on the other side. They are very clear that Doge and Elon Musk and Donald Trump are creating waste. They are causing abuse, and they are opening the door to fraud. They keep changing their rules. So going after this non-existent fraud, they say that people cannot, they came out with a new rule that people cannot apply for benefits and change their blank routing numbers over the telephone. Well, there are plenty of people who don't have broadband, maybe an hour away from field offices, may have mobility issues. That is absurd. And they reversed themselves, but not before the American people were so confused, and because a lot of people misunderstood and thought their benefits were going to be terminated if they didn't go into a field office and prove who they were. And as a consequence, we know there are scammers that jumped on that and started sending out very official looking letters to people saying, your benefits are going to be suspended unless we know who you are, so give us all this personal information. And for every one that got reported, I'm sure there are 10 who were scammed. So there's a lot of bad stuff going on. And the worst of it is that we don't know what they're doing with these systems. And those who are very knowledgeable have told me that they think it's highly likely that, and it's certainly, even if it's not highly likely, it's certainly a strong possibility that benefits will get interrupted, that we might have millions of people getting overpayments and underpayments, or even worse, that benefits just won't go out. So it's very, very concerning. And normally what you would have is some oversight by Congress. But of course, the Republicans are doing none. There are a lot of people who are upset and raising issues at town hall meetings, but a lot of the Republicans are saying, okay, well, let's not have town hall meetings. We have had April 5th was a hands-off day of action. There were every state, millions of people, and a lot of the people there were older and holding Social Security signs. There was an April 15th hands-off Social Security tax day because it was linked to making the wealthy pay their fair share, not giving tax cuts. And there will be more and more actions. They're also, on top of it, Doge has said they're going to close field offices. So here you can't get answers on the phone, you can't get field offices. The agency was already extremely understaffed at a 50-year low, and they are not only hollowing out the agency, but getting rid of, reducing another 12 or 15% of people. And so it's there, at the very least, there are already longer wait times, longer backlogs, longer, getting busy signals when you call the 800 number, that sort of thing. And at worst could be an effort. And I think the long range plan may be destroy the Social Security Administration, throw up your hands and see government doesn't work, and turn it over to Wall Street. We have a commissioner who is who lied to Congress and lied to the Senate, because he's been very intimately involved in everything that's been going on. He said he wasn't, but they have a whistleblower complaint saying that's a lie. And I know from a number of people inside he's been very involved. And I'm afraid that he will get confirmed, and when everything falls apart, they will try to privatize at the very least the administration of Social Security, which will waste our tax dollars. Social Security is extremely efficiently administered. This will be much less efficient. It will be let for-profit companies know our private data. It just cannot happen. It's as bad as privatizing the benefits. So I think we should all be alarmed and be as active as we can to, again, at the very least, get a change in 2026, but way before that, demonstrate, make our voices heard, talk to friends and neighbors, because this, as I say, is an issue that unites us all. So with that, Jan, I don't know if you want questions or anything else, but I hate to give such a dire report. Usually I'm upbeat.
Yes. Well, there aren't any questions in the chat. Maybe they will come along. But Nancy, I'm wondering, is there any litigation going on?
Yes, thank you. Yes, it's very, thank you for that question. A number of the unions asked me, AFGE, I think AFT, maybe NEA, have brought a suit against the Social Security Administration and against Elon Musk and Doge, and they've been winning. So it's a very good judge, Ellen Hollander is her name, in Maryland, federal district court judge, who put in a temporary restraining order and just a preliminary injunction that says, Doge, get your hands off of all of these, our data. Any data that you have with personal identifying information, you've got to delete it. Now, the first response when that happened, the acting commissioner, I'm sure under reports from the White House, said, oh my gosh, they can't have access to that. Well, that means we can't run the program. We're going to shut down the agency. Well, of course, everyone went nuts at that and they backed off. But what I've been told is they are embedding people in the agency. They're trying to get around the court order. The judge is looking carefully, but part of the problem is that more and more people have left the agency. The people who are there are very scared, and they, some of them have bravely written whistleblower complaints, but it's getting harder and harder to get the information. So they're not, everywhere else, as they've done everywhere else, they are not respectful of the rule of law. But this is a very good judge, and it is plaintiffs that care very deeply. So that is a bit of a check on what is going on.
Well, thank you so much, Nancy. I guess we are all now really motivated to go out every Saturday and hold up our signs, save Social Security, and certainly resources such as yourself are so valuable in letting us know what has gone on and also why Social Security is so important for this country. So thank you for participating in this program, Nancy, and we value your expertise considerably, and maybe at some point when there are some victories, we can have you back and talk about those.
That would be great. I would love to do that. And thank you, Dan, and thank all of you for having me.
Great, thank you so much. We're going to go on to our next guest, and Professor Ku is going to be introduced by Connie Portavia.
Thanks, Jan. As a health policy researcher, a public policy analyst, and an advocate, Dr. Ku's career has been built around the effort to understand and improve access to affordable health care for vulnerable populations. Among his areas of expertise are national and state health reforms, Medicaid, the Children's Health Insurance Program we know as CHIP, immigrant health, prevention and health care, financing, and budgets, with an emphasis on strengthening the healthcare safety net. He's very interested in applying the lessons of research to policies and programs at the federal and state levels and working with government officials and community groups and advocacy organizations to advance policies and progress. He's authored or co-authored more than 100 peer review articles and 200 other policy and translational health policy reports. And as a faculty, he has taught research methods and statistics at the graduate level for 25 years. I can't tell you how poorly I did in that in my graduate work, Dr. Ku. As a member of the community, he has helped develop and guide the District of Columbia's health insurance marketplace since 2012 as a member of the executive board. He joined the George Washington School of Public Health as a full-time faculty member in 2008, but he's actually held adjunct positions at GW's School of Public Policy and Public Administration since the early 1990s. During that time, he also served as a senior fellow at the Washington-based Center on Budget and Policy Priorities, which focuses on improving policies for low and moderate income Americans. As principal researcher at the Urban Institute and as a policy and budget analyst for the Federal Women's, Infant, and Children's, or WIC, nutrition program. Dr. Ku, I give it to you. Whoops, oops, whoops. There you go.
Thank you very much, and I'm impressed at how much you know about me.
It's all, you know, the internet's a wonderful thing.
Anyway, thanks for having me today. If you don't mind, I'm going to share some slides, and so I'm going to try to do that now, and hopefully I will not flub this up.
You can do it.
So anyway.
There you go.
Okay, good. I'm glad to know that's working so far. Let's see now. So here I'm going to talk about some budget analyses that I've been doing with some of my colleagues here, really talking about some of the big changes that are being discussed in Congress right now under what's called budget reconciliation legislation. So let me just start out, and I'm sure that all you guys have heard about this. It's sort of well known. There are some potential budget cuts that are being discussed for health and nutrition programs and other programs that really aimed for low and middle income populations. This is being done through the budget resolution process. The House and the Senate differ somewhat in what their approaches are, but they passed what's called a concurrent budget resolution. And in addition, the House and the Senate leaders have agreed to find $1.5 trillion in spending cuts. And so the big targets there are Medicaid and the SNAP, used to be called the food stamp program. So just for a reminder, about 2/5 of the participants in both Medicaid and SNAP are children, and a majority of the adults in Medicaid and SNAP are low-income women. So these cuts are designed really to largely offset some huge tax cuts and some extensions to primarily help low-income people. Some of the big sort of overall targets that they're working on for these budgets are, people are talking somewhere on the order of $880 billion in Medicaid cuts over the next 10 years, $230 billion in SNAP cuts that together is more than $1 trillion. And then letting some of the enhanced premium tax credits that exist for the health insurance marketplaces, also known as Obamacare, expire at the end of this year. Altogether, well above $1 trillion in losses. And just to give a sense of how this, hold on, let me see, why is my, somehow my, oh, there it is. Sort of what's the distribution of this? These are some analyses that researchers at Yale did basically saying, when you look at the distributional impacts of this, sort of who's benefiting and who's losing. The way these budget proposals are set up is to preferentially increase incomes for the top 20% of the public. So if you're in the upper income strata of the US, you'll have about $6,000 more in your pocket because of this. If, on the other hand, you have the misfortune of being in the bottom 20%, you're going to be about more than $1,000 poorer. And if you're sort of somewhere in that sort of second quintile, you're still several $100s poorer as a result of these changes. So there's no question that the changes are intended to sort of tilt the balance and to make things somewhat better off for wealthy people, and definitely some deep cuts if you're a low-income person. So we've done some sort of specialized analyses, and we're focusing on the economic and employment impacts of these changes. And I will say there are lots of other analyses that wonderful researchers and analysts all across the country have done, saying, some of the specific cuts that are being proposed, how they could hurt, people, and the people who are the beneficiaries of these programs. That is, if you lose your Medicaid, more people that are uninsured are going to be uninsured. They're going to have poorer access to healthcare or to medications. If you lose your SNAP benefits, there's going to be more hunger, that certain populations will be harmed, children, pregnant women, the elderly, and so on and so forth. I will say one of the things that makes it a little hard about these analyses is that the details of the budget proposals still aren't clear. Congress has not said specifically what they want to do. They're planning to sort of unveil their so-called budget reconciliation proposals next month, beginning in May, and then that legislation probably will be debated certainly in May and probably through much of the summer. These are going to be some tough struggles. We've decided to approach this in a slightly different way. So we did some analyses that focused on what were the economic and employment consequences of these changes. And part of this is because other people have done great work showing sort of how the people who are the Medicaid and SNAP recipients are going to be harmed. We wanted to show sort of what I might call sort of more of a Main Street approach, basically sort of saying, what's the impact on state economies? How many jobs are going to be lost because of this? What are the effects on state and local government revenues? And part of this is meant to concerns among moderates who might be the swing vote. So these are the kinds of things that might be of interest to governors, state legislators, chambers of commerce, and so on. And really, what we're saying is the analyses we do sort of are saying, look, we realize that in fact businesses are going to be hurt. The people who work for these businesses are going to be hurt, and state economies are going to be hurt. So far, when we've done these analyses, we were just looking at sort of very broad-based cuts. We don't know what the specifics are. But let me give you a sense of how this works. This is something that we call sort of how the multiplier works. And so this is how, when there are some of these deep cuts in things like Medicaid funding or the premium tax credits under Obamacare, how that plays out. So when you lower those federal Medicaid funds, basically speaking, healthcare providers, hospitals, clinics, pharmacies, long-term care programs have less funding. And because they have less funding, they need to reduce how much they're going to pay their staff. And so that lowers how much their staff is getting. In many cases, that means they're going to have to lay off staff. In addition to this, these providers also buy things from other places. They pay their rents, they buy supplies, they have other places down the supply chain. So they need to reduce those purchases also. Those businesses in general, when they lose revenue, also need to lay off staff or reduce their hours and so on and so forth, and reduce how much they're buying from other things. When staff have their hours cut or when they get laid off, this limits how much they can purchase as consumers. Like you and I, everyone needs to buy housing, food, transportation. You need to pay for your child to go to college and so on and so forth. When money gets tight, these things have to get limited. So that has other repercussions through the economy. And in the end, when we see reductions in individual and business incomes, then this ends up creating lower state and local tax revenues. So our system tries to model this using an economic system called Implan. And this is just a summary of the national results that we have. If there are these deep cuts in Medicaid, we are talking that in a single year, states will lose, their economies will be about almost $100 billion lower. 880,000 jobs will be lost next year beginning this. If the state and local tax revenues also fall, once again, because individuals and businesses lose income, state and local taxes go down, and because of that, state and local governments have a harder time balancing their budgets to pay for education, infrastructure, all the things that state and local governments do. I will say, when these talk about these changes at the federal level, they often talk about federal savings. Part of what we're trying to do is say, gee, when there are these so-called federal savings, someone has to pay for them. And where they get paid for is at the state level and individuals and businesses within the states. So SNAP, if they have the cuts on the tune of $230 billion, we're going to see states every year. And so this is actually just estimates for the first year in 2026. State economies will fall by about $18 billion. There are going to be about 143,000 jobs lost. State and local tax revenues will fall by 1.8 billion. The other thing were the enhanced premium tax credits for Obamacare. If those go away, we're going to see about a $34 billion reduction in state economies, around 285,000 jobs lost, and about $2.1 billion lower in state and local tax revenues. All told, we're talking about state economies will take a hit close to $150 billion. More than a million, about 1.3 million jobs might be lost, and state and local tax revenues will fall by about $11 billion. Now, I'll mention, it says this at the bottom of the note, about half the job losses are going to be in healthcare. And this is because of Medicaid and premium tax credits, and that's where that money goes. About half of the SNAP job losses are in food-related fields, grocery stores, food production, agriculture. The rest are spread all across the economy, and that's because of this multiplier effect in which the effects of these deep cuts in federal spending ripple out through the rest of the economy. So I just want to mention another thing. One of the things that comes up a lot in discussion recently is the notion of, in many cases, conservatives are saying, oh, gee, we can cut these programs, Medicaid, SNAP. No one will get hurt. There's just lots of fraud and waste in these programs. And what we're going to do is get rid of the fraud and waste. First of all, the fraud and waste in both Medicaid and SNAP is really rather small. There's a little bit of waste and fraud that happens in any program, I'm sad to say, but nonetheless, the level is quite small. The real area where there's lots of sort of waste and fraud is actually in our tax system. So there's something called the federal tax gap. The tax gap is the difference between how much is owed in federal taxes and how much is collected. And the difference is primarily due to compliance and fraud. It's that people do not report their taxes adequately, and basically they cheat on their taxes. So right now, the tax gap is estimated to be around $769 billion. That's a lot of money. That is way more than the amount of money we're talking about the cuts in Medicaid and SNAP are totaling up to. However, rather than trying to reduce this, what the Trump administration has done is cut IRS staffing. And so the estimated effects of cutting the IRS staffing, so the Yale Budget Group said this is going to increase the tax gap by about $134 to $298 billion in 2026. Others have given even higher estimates of how that's going to lower our tax revenues. And the tax gap is mostly driven by people who have the highest incomes. And when we reduced IRS staffing, it reduces the ability to monitor and see that people are paying their taxes adequately. And basically, it tends to increase non-compliance among the wealthy. So while there is discussion among conservatives about fraud, error, waste in Medicaid and SNAP, these are minuscule compared to the federal tax gap and the impact of the federal staffing cuts, the IRS staffing cuts. So the reality of the matter is what we really want to see is better fiscal stability in the country, reducing the deficit. Improving tax compliance is the much more effective way to do this than trying to have these deep cuts in Medicaid and SNAP. Essentially, the deep cuts in Medicaid and SNAP are merely they're trying to take it out of people who have the least ability to defend themselves. So I'll just mention, we did these analyses, I've discussed them at the federal level. Actually, we have data on every single state in the country, and I can't go through it in this talk, but here are the websites of the reports that we do in the state tables. So if you wanted to know and you wanted to talk to your congressman or your senator, this is where the estimates are for your particular state. I will add that we are doing further analyses, so we're going to be continuing to do analyses on further as we go further in these discussions of some of the specific policies, and as we begin to get a better sense of what are the actual budget proposals that are being discussed in Congress. Anyway, so that's what I have to say. I'm going to stop sharing my screen now. I appreciate the ability to give a talk to you. Bye. Or actually, I'm not saying bye. I'm just stopping the screen.
Thank you so much for, you gave a wonderful presentation at the Coalition on Human Needs, and that was how I met Dr. Ku. Now, does anybody have any questions? I've put the links in the chat for that, for your presentation. I took them out of your report and put them into the chat so that people could copy them and get the firsthand information. Are there any questions for Dr.?
Someone asked, can the PowerPoint deck be shared? That's completely fine with me. If you want to share the
Okay.
the slides with other people, please feel free. It's all public information.
We're recording this now, and when we put it on the web, we can put the PowerPoint presentation with it. I have to tell you that you haven't made my day, either one of the speakers. I never thought I would live in a time like this. It's an amazing fact, but we can't stop. We have to fight back. Justice means resistance. So, and Karen has her hand up now. Okay.
Just a comment. First, incredible information. Thank you. It is all worse than all of us thought. I just noticed, I just looked up the numbers. Fewer than 30% of elected people across the country at all levels are women. I don't think it's a coincidence that the people who are wielding the power right now and the people who will benefit are basically white men with me. So I would argue that the most important thing we can do between now and the end of 2026 is to elect more women, not just women, but women who care about these issues and who are strongly wishing to support the safety net and others. I noticed my California president of National Women's Political Caucus is on here. There are many organizations. A caucus is the oldest and the greatest, but we support women. And we try to change the numbers, and California is now close to parity. It's still struggling to change the culture. So this is devastating for women, children, every marginalized group in the country. And we have to start right now getting people elected because the lead time is so challenging. So that's my basic comment about all of this. Thank you very much for the information. It was very, very devastating.
Are there any other questions? Comments? Is anyone sobbing in the background? No. I do have one more piece of information, and that is there's an impact of SNAP reductions on health, economy, and community resilience webinar that's going to begin directly after this one, and I will put that also in the chat so you can register and sign up for it if you would like, because I know that's one of the projects that's dear to your heart too, Dr. Ku, even though we didn't talk about it today so much. Well, if I don't see any other, let me go to the other page and look, see if I see any hands. I don't see any hands. Okay, and with that, I just want to do one more thing, and that's wish Ellie Newman a happy 100th birthday. Take care of yourself, Ellie. Okay.
Bye. Thanks.